Hello, we will talk to you about of the prevention high blood pressure. Did you know that is estimated that in Mexico more than 30 million the people live with high blood pressure? That is one in four has this condition, and 46 percent don't know it. According to today, the National Institute of Statistics and Geography from 2020, is say to 24% of men and 26% of women. They have these diseases. Every year it causes about 50,000 deaths.
That's why it's important to be informed about prevention measures, the causes, etc. What is the high blood pressure? It's defined as the BP sustained above the normal limits measured in mmHg in two measurements separated by at least 2 minutes. There are two main types of hypertension. One, essential or primary, usually develops over time as you age. Two, secondary, it's caused by another medical condition or the use of certain medical. Three, what causes persistently high blood pressures levels in the office at normal ambulatory blood pressures of 24 hours, that is fear of a diagnosis or the doctor.
Among some symptoms we have headache, tired, damage to vital organs, dizziness, nausea, shortness of breath, tingling, pressure of the chest, feeling a very strong heartbeat.
Some one of the causes. One is vascular injury. Two is endocrine. Three is pregnancy. Three is eat unhealthy foods frequently. Four is drink too much alcohol or caffeine. Do not physical activities. 5, smoking or taking drugs. 7, getting out hours of good quality sleep. And finally, acute stress.
Risk factors: advancing age, general causes, overweight or obesity, lack of physical activity, eat with a lot of salt, drink too much alcohol, and sedentary lifestyle.
Diagnosis and initial evaluation include ask about lifestyle with the aim to identifying cardiovascular risk factors. Another is secondary arterial hypertension, white coat or reactive hypertension must be ruled out. Assess the mesh to target organ. Perform a complete medical history, physical examination, and laboratory studies.
The physical examination includes adequate recording of blood pressure with the following features: appropriate measuring device must be available. This includes the correct size of the bracelet according to the physical constitution of the individual. The patient must have been sitting and relaxed for at least 5 minutes, with feet on the floor and arms at head level. Avoiding getting caffeine and cigarette stimulants or exercising. Avoiding getting caffeine and cigarette stimulants or exercising 30 minutes before taking blood pressure, and last two determinations must be carried out with a difference of 2 minutes between them. Once the cuff is placed, it should be inflamed to 20. Once the cuff is placed, it should be inflated to 20 to 30 millimeters of mercury, obliteration of the radial pulse. The deflation speed should be 2 millimeters of mercury per second, recording the first and last cardiac sounds of the systolic and diastolic numbers respectively. Treatments for high blood pressure include medications, and as already mentioned, healthy lifestyle change. Taking care of your health is also important.